The broadcast is now starting. All attendees are in listen-only mode.
Hello. Thank you for joining the webinar, 3 Years of CPRA, Lessons from the Field. We are thrilled to have Hani Mansourian presenting today on his research with the Child Protection and Crisis Learning Network on the uses of the Child Protection Rapid Assessment Tool in the field. Before we get started, I have a few logistics to share with you. On your screen right now, you should see a poll asking you to select all that apply to you. You can select multiple responses, so please respond fully, as it will inform Hani's presentation. We will have that poll open until I turn the ropes over to Hani to present. If there is interest, Hani will share some more information about the CPRA at the end of the webinar. If you are very familiar with the CPRA already, please feel free to hop off at this point. Throughout the webinar, all participants will be muted so as to improve the sound quality for everyone else. If at any point you have a question, either for Hani about the content or a technological question, please send a question to me, Rena Dietz, the organizer. Everyone should have a taskbar on the right-hand side of their screen, which has the option to submit a question. I will respond to logistical questions throughout the webinar, but please also submit any questions for Hani. At the end of the first section of the presentation, in which he shares the findings of the review of the CPRA, we will open up to a question and answer section with the questions you have submitted. Now, I am thrilled to introduce Hani Mansourian, an expert in monitoring and evaluation and a doctoral candidate in global health and humanitarian systems at Columbia's Mailman School of Public Health. He has quite an impressive history working in the fields of child protection and humanitarian response for over 10 years. Hani was the assessment and measurement focal point on the rapid response team of the Global Child Protection Working Group, who many of you are familiar with and work with. Prior to this, he worked with a variety of international actors, including UNICEF, UNDP, and the IRC, on monitoring evaluation and other child protection programs. Now, I'm thrilled to turn it over to Hani to share the findings from the CPRA assessment. All right. Now we're going to end the poll in just 30 seconds. So if you have not responded, please respond now. And then we'll use those responses to inform Hani's presentation. The poll is closing. And Hani, I will turn it over to you now. There you go.
Can you see my screen now?
Yes.
Perfect. Thank you, Rena, for the introduction and for organizing this. Hi, everyone. Thank you for joining. It feels a little strange not to be able to hear you guys, but I will try to go through some of the lessons that we learned through the systematic review that we did on the use of the Child Protection Rapid Assessment in the past couple of years. And as Rena explained, if you have any questions, please just ask through the chat mechanism, because I can't hear you, or we can't hear you because we're all muted now. So just to start, I wanted to give a quick background about how this lessons. Oops. Let me just quickly just give a background on how this exercise of creating a review of the CPRA came about. It basically was part of the work plan of the Child Protection Assessment and Measurement Task Force, which some of you are part of and otherwise familiar with. Last year, around May or June, I think the discussion started, and the CPC network was commissioned to do this review on behalf of the Assessment and Measurement Task Force. Debbie Landis was the lead researcher on this piece. Alistair Ager and Lindsay Stark were as well part of the team. So I just wanted to first thank all of them for the great work that they've done, and hopefully this after this webinar, this is going to be the result is going to be even more widely shared with you guys. So, okay, I'm being told that I sound a little quiet. Maybe I'll speak louder. I hope you guys can hear me now. Okay, good. It seems that I'm more clear now. So just a quick overview. It was a structured analysis of the learnings from the field on how child protection rapid assessment tool has been used in different contexts. The data collection was done from May to September 2013, but then follow-up calls and analysis went all the way into the end of 2013. Four specific methods were used for this process. The first one was development of hypotheses and question, and I'll give you a little bit more detail of these four methods in the next slide. The second was distribution and completion of remote questionnaires, where questionnaires were sent out in a written form to people who have been involved in implementation of the CPRA. And then follow-up interviews were done to dig deeper into some of the issues that were raised, and then data analysis and report writing. Just to give a little bit more on the methods and how the process was done, to develop the hypotheses, several documents were reviewed, including some of the reports of the CPRA activities that were done in different countries, consultation with some of the people who have been involved in multiple CPRAs were done, and the result was 12 hypotheses that were developed. Basically, these hypotheses were the lead for the type of questions that we wanted to ask. But then at the end of the process, once the data was analyzed and everything was, all the results were received, we decided that only 3 of the 12 remained relevant to the data. So a lot of them we did not receive much or meaningful information about to be able to say much. Just to give you an example, for example, one of the hypotheses was that if the CPRA is done in an interagency manner, it's likely that the results will be better used or more relevant. But the data did not show us much about this. So, and one part of it was because only 2 of the 15 countries where we collect data from actually did it in a non-interagency manner. So it was really not meaningful for us to draw any significant conclusion from the data to inform that specific hypothesis. So that hypothesis was dropped. And there's a list of other ones that I can speak to if anyone is interested. And I will talk about which hypotheses were retained later. Then remote questionnaires, and the questionnaires were developed based on those hypotheses. Then remote questionnaires were sent out to individuals who were involved in using CPRAs. Originally, we sent it to 18 countries. This does not mean that it was sent to 18 individuals, because some of these countries where CPRA was done had the same coordinator or assessment lead who led the process. So at the end of the process, we only received responses from 12 individuals that represented 15 different contexts. And then upon initial analysis of the information that we received through the questionnaires, follow-up interviews were done with, we tried to reach all 12 individuals who filled out the initial questionnaires, but only 11 of them were reachable. Multiple attempts were done to reach all of them, but it was not possible. So basically, only one of the countries, it didn't get dropped out, but we were not able to get further detail on one of the 15 countries. So 14 countries gave us more complete data. And the last part was compilation of all the data that were received through the questionnaires and through the interviews, and coding them and coming up with more coherent results. So just a kind of an overview of the sites where the review was done about. You see the list there. I'm not going to go through it, but you see that there is a kind of variety of context, from droughts and refugee situation to floods and typhoons and refugee context, internal conflict context. So the type of context that were covered is pretty varied and hopefully represents a good kind of spread of what type of problems and issues might arise when CPRA is being used. So the first hypothesis that was retained out of the three was this one, the one that was about the timing of the CPRA and whether doing the CPRA earlier in the process actually has any effect in the way results are used. And just a reminder that the first statement that you see there, which is the hypothesis itself, is just a hypothesis. Because I've had queries from people saying that this statement does not seem to be supported by the data. And it's true that this statement specifically is not supported by the data because it didn't come out of the data. It was a hypothesis that was developed earlier. So the results are as follows. I'm going to explain the results that came out of this hypothesis. We found from the data that conducting the assessment beyond the early phases of the emergency makes it less likely for the results to be used in programming and strategy making context. For strategy making and programming ends. We found that 11 out of the 15 contexts used the results in program development and adaptation of already existing programs. Sorry, Rina, I keep getting a message on my screen that says you have to change the color scheme. I don't know what to do about that. Keeps popping back up.
I'm not sure what that is. That's the first time I've heard of that. I think ignore it because your color scheme looks fine on my end.
Okay. I'll keep ignoring it. Thank you. And then in 8 of the 15 contexts, the results were used in planning and strategy development. So what we kind of concluded from the results of the review process was that doing the assessments earlier, and by earlier it doesn't mean, let's say, a week after the emergency, but based on the actual recommended timeline of the assessment, which is between one month, rather 3 weeks and 2 months after the after the emergency, chances that the results can be helpful for programming and strategy development is much higher, which is in line with common sense. I feel like that makes sense. And another point that I wanted to make is that the tool is developed for that very specific time period. If you use it before, let's say 3 weeks or a month after the emergency, it's going to be too heavy, it's going to take too long, so it's probably not going to be a satisfactory process for informing very early on programming. If you use it too late, let's say 3, 4, or 5 months after the emergency, normally you can do better than just the recommended methodologies in the CPRA. So again, in that case, if it's already 6 months into the emergency, maybe we want to consider doing something more comprehensive than the CPRA. So all kind of pointing to, all the results kind of pointing to us trying to encourage the field to remain loyal to that time period that is recommended, which is about a month to 2 months after the emergency. And there were also examples of delays in final report writing, which in some cases caused delay in the use of the data, and in some cases, for example, in Mali, it didn't as much because some initial findings were already shared a week after the analysis was done, while the final report took several months to come out. So there are ways around if there is not enough staffing or people don't have time to comment on the final report, to share some initial findings earlier on to make sure that the results get used earlier. And this is an overview of who used the results for what. We see that the third column, so if we don't consider the country column, the third column from the left, program development adaptation is what most people used it for. And then the second after that is planning and strategy development, which also makes sense because given that 13 out of the 15 countries use this in an interagency manner, it makes sense for us to see that this was used for strategy development. The second hypothesis that we tested and found data supporting it was that the provision of support from the child protection working groups serves to mitigate challenges throughout the assessment process. And we found kind of an overwhelming support for this, that all those countries who received support from the child protection working group in the process were pretty happy with the quality of the support and the amount of the support that they received. Just to give you a sense of what kind of support that was provided, there are several types of support: remote, in-country, or specifically just on data collection, data analysis, or just on design. But 8 out of the 15 received in-country support. So someone from the Child Protection Working Group Rapid Response Team was sent to the country to support the process. 12 out of the 15 received remote support, which has some overlap with the 8, because in many cases the rapid response team that was team member that was deployed did not stay for the whole process that sometimes takes up to 2 to 3 months, but rather went in for part of it or initiated it and then followed up with remote support. And some of the interviewees specifically mentioned issues around the data management tool and lack of capacity on that, which I'll come back to. The third hypothesis was about how pre-assessment training might lead into better results or higher quality. results of the assessments, and we found that the only one country that did not receive any kind of training before the assessment process started reported multiple difficulties, and that was the case of Somalia, where things happened really quickly, and because of timing, because of resources, and because of lack of access to a lot of data collection teams, no training was provided, and a lot of difficulties in terms of getting the data to Nairobi, where data was being compiled, was faced. Then a lot of problems about how to find out what questionnaire was related to which area of Somalia, who filled it out, was it a female who responded? There was a lot of problems. I don't know if any of you guys were involved in that process, but the good thing was that it created an opportunity to learn from these mistakes, and a lot of those who were involved went on being involved in other types of assessments or CPRA in specific, in particular, and found that process of learning through the mistakes of Somalia very helpful. So we found that the training component is super important. There were several calls for more training on CPRA, even outside of the context of an emergency, to prepare people to be able to conduct the CPRA in a more systematic manner once they are in an emergency context. So it seems that there is the need for even further training, even though if you look at the report, you will see that there has been a lot of training activities happening, but there is still need for it. We also, when we were developing the hypothesis, we also developed one question. We weren't sure how to develop a hypothesis out of it at the time, so it was kind of a leading question for us. So it was the question about how adaptations affect whether or not we receive desired information or results from the CPRA. And we found that first, in nearly every single country or rather, all the countries that used the CPRA, some sort of adaptation was done, which is very promising and encouraging, because that's one of the things that CPRA advocates for. Any generic tool like the CPRA cannot be specific enough to different contexts. Therefore, adaptation becomes a very, very important part of making sure that you receive context-specific results. So we're very happy to see that it actually happened in all of them. 8 out of the 15 countries did minor adaptations, which were basically more or less about adapting the questions themselves, the language of the questions, adapting the answer options, and not so much about methodology and adding additional methodologies. 7 out of the 15, along with the methods recommended in the CPRA, used other methods. And I will talk about that a little more in a later slide. And there was a general sense among respondents that the results were close to what they were hoping for, which is again encouraging. Some of the countries that did more specific methodological adaptation, or rather adaptations were more significant, faced more problems with the data management tool, which is again normal and nothing outside of what we expected, in the sense that the Excel tool that accompanies the CPRA is specific to the structure of the CPRA, and once you step out of that, unless you have good IT support, it might be difficult to use the CPRA data management tool for your assessments. This is again an overview of the sites where the CPRA tool was used according to the recommendations or with additional tools. So I won't go into the details of it, but it's in the report as well. You can look at it. So just one additional slide on the adaptation process. We found that most countries that used an additional methodology used focus group discussions, which is again to be expected, mostly because focus group discussions are commonly used in the humanitarian world, specifically in the area of child protection, because it's a qualitative method and it can be done with different age groups in a relatively easy way, even though within the child protection rapid assessment, focus group discussions are not recommended as one of the core methodologies, mostly due to the fact that a well-done focus group discussion takes a very long time to be implemented and analyzed properly, and we have seen way too often that the focus group discussion was not analyzed the way it should have been, in the sense that it's more about taking out quotes from one or two participants than systematically analyzing the scripts that come out of the focus group discussions. But in areas where there is capacity, it's a great tool, and it's good to see that people are using it where they think they have the capacity. And another addition that we have seen in some of the cases was interviewing children in either as key informant interviewees or focus group discussion participants, which is again something that child protection rapid assessment does not encourage for do no harm reasons and best interest of child reasons, but it also encourages the users to do it if they do have the means to do it, which is rarely the case in early stage emergency context, but given that most of the countries that were studied here actually didn't use the CPR in the early stages, it makes sense for them to have used methods like focus group discussions or having involved children, since they probably had the expertise to do it and the time to spend on it. Some other findings before I go to the last slide, which talks about recommendations, are about sometimes, and this is again something that is highlighted in the CPRA, sometimes countries get into trouble about ownership of data. And in one specific case, we found that because initially it was not very clear who the owner of the data or who has the final word on how to report the data, some of the actors were not comfortable with the results, and it ended up delaying the process of finalizing the report significantly, and that resulted in the report not being used as much as we hoped for. So it's important to start talking about how to make decisions about how to report and who holds the final responsibility for the results from early on, to avoid these kind of issues. Data quality was reported as being high, as I mentioned. Involvement of children was a recurring theme in some of the responses in the interviews, which is something that came in the recommendations. I'll talk about it in the next slide. And then overall satisfaction with the toolkit was pretty high, and in many contexts, CPRA, the CPRA process, that shouldn't be processed, the CPRA process facilitated coordination efforts and to create harmony in the response, and that's a very positive side effect that we have seen in multiple contexts from the CPRA. That once this, because it's being done in early stages, and because it's often done in interagency manner, it actually becomes a point of common reference for a lot of actors, and they end up being closer to each other and talking to each other more easily because they engage with each other through the CPRA process. And issue of more training on CPRA came up in multiple of the responses. And the last slide I want to share with you is some of the recommendations that came out. One of them is everyone was encouraging the Child Protection Working Group to continue the type of support that they're giving to the field. I don't know if anyone from Child Protection Working Group is on now, but I am going to say thank you for all your support so far on behalf of the respondents, and we would like you to continue. Child Protection Actors, so one of the other recommendations, Child Protection Actors should strive to use the CPRA during phase 3 of the emergency, which is according to the Interagency Standing Committee time frame. It basically starts around third week after the emergency and can go on for up to 2 months after the emergency. So it basically seems to us, even though I would agree that we don't have enough evidence out of this data because no one really did it in phase 3, but it seems from the result that those who did it around 2 months point as compared to those who did it in 4 or 5 months point, they managed to use the results in a much more efficient manner. So it seems that doing it earlier on, again, not the first 2 weeks or so, but during the first or second month after the emergency would help the result being more useful. And then additional guidance on the involvement of children in assessment, which is something that we take on and hopefully we will be able to provide more information on. The Assessment and Measurement Task Force is launching a process of consensus building around this issue of involvement of children in early phase emergency assessments. So hopefully out of that we'll have a clear idea of what this sector deems an appropriate way of involving children in those early phases of an emergency. One thing that I have mentioned to several countries in the past, and I think now should be our primary way of involving children in the CPRA, is to involve them in the analysis and interpretation part of the process, which is a pretty safe way of involving children in those early phases when services are not yet available in the field and we can't ensure the safety of children if we go ask them a question out in the field and then leave the next hour. So involving them in the interpretation process is probably the safest at this point. And then also the last recommendation was additional clarification for the rationale behind the design of the CPRA toolkit, which is something that hopefully we'll work on and potentially add a little explanation to the guide. There is already explanation about why these were used in the guide, but if additional clarification is needed, it can be provided. But I can just quickly tell you, I know I'm running out of time, but quickly say that in the design of the CPRA, it was basically a battle between higher quality and having something that can be done quickly with not highly trained assessors that will give us some meaningful results. So it, those who were involved in the process of developing CPRA remember that the slogan was always good enough. We were not going for something perfect, and we were not going to compromise for something that would not give us robust information. And that's why we ended up going with the three main methodologies that are used now in it, which is desk review, direct observation, and key informant interviews. There's no doubt that the more you add, the more tools and methods that you add to a methodology or toolkit, the stronger it's going to get, but at the same time, the harder it's going to get for it to be used in the field in a timely and efficient manner. I am done. I'm happy to hear your questions or comments. Back to you, Rina.
All right. Thank you, Hani. I think for all of us that was really insightful and really brought the CPRA to life. We have a few questions. The first is, how has the CPWG been able to enhance child protection work in the countries where the assessment has been done?
There are different ways that this has been done. The most important one is through strategy development. So the CPRA in several countries, I think in 7 or 8 out of the 15, helped the coordination mechanism, which is basically the extension of the Child Protection Working Group in country, to bring the actors together and decide what areas of focus are actually more important as the common strategy of the Child Protection Working Group or the coordination group. So that's one way. The other way that I think we saw in 6 or 7 out of the 15 was through using the results of the CPRA in fundraising. So in many contexts that I've personally experienced or we have seen in the results of the review, coordinators or coordination mechanisms managed to bring to the attention of donors the issues that came out of the CPRA and encourage them to dedicate some of their funding to those issues that some of which were not on the radar of donors before this process was launched. So those are the two specific ways that I think, and the third one is the one that I mentioned, which is CPRA has proved to be a very effective rallying point for child protection actors coming together to do the assessment, but then the assessment itself gives them a common frame of reference, which allows them to be much more efficient going forward in the response.
Great. The next question is also related to the Child Protection Working Group. What does the composition of the Child Protection Working Group look like in the countries where the assessments were done, and is the composition similar or different in these various countries?
I mean, I'm not sure if I can, how I would answer that question, but I think one thing I can say is that fortunately or unfortunately, a lot of the time countries where the coordination mechanism, Child Protection Working Group, is stronger in country end up being the ones who actually do the CPRA. And that kind of makes sense, even though it might be a sad reality, but it makes sense that where you have a good coordinator or a coordinator who has been there for a while and a strong coordination mechanism in general, you're more likely to think about things like an assessment than a country where no coordination history exists or an emergency has happened and no agencies have tried or been able to bring in bring in a coordinator to lead on the coordination process. So I would say it's not that the composition of the child protection working group necessarily changes based on assessments, but I think anecdotally I can see that countries that have a better and more organized coordination mechanism often end up being the ones who do assessments and normally do it in an earlier stage. But as I again said, it sometimes might work the other way around as well. The fact that an assessment happens rallies people to try to coordinate more and be more efficient on that front. Back to you.
All right. So this is a question about the optimal moment for conducting a CPRA. The understanding is that the optimal moment is between 3 weeks to 2 months, and this is a busy time when it can be hard to divert resources from programming. So it's food for thought and sort of a question around how to manage that.
That's a very good question. I don't have a very good answer to that, but then at the same time, it's a chicken and egg question. Is it better to focus your resources in finding out what is actually happening and have evidence to support whatever fundraising process you want to launch, or is it better to continue providing response because you can't afford the resources that are needed for the CPRA? I think it will change context to context. In some contexts where an emergency has been going on for a long time and you have potentially a lot of existing sources of information, I would say maybe doing the CPRA might not be, and you don't have much resources, doing the CPRA might not be the best use of your resources, because you can do a desk review, a quick desk review, using the existing information, and not necessarily spend your resources and energy on collecting primary data. But in other contexts where you don't have much in the sense of existing information, and you're basically just programming based on the knowledge of program staff from other countries or from development contexts, like for example in Mali, I feel like doing an assessment is very potentially very cost effective, even though it will cost money. It won't go to waste. It will help you develop good strategies and inform your programs and advocate with your donors for the right type of funding to be channeled to organizations. So I think it changes from context to context. CPRAs in general have proved to be pretty reasonable in terms of cost. In some countries, we have managed to do it for and when I say for very cheap, I mean in terms of the actual dollar cost. We have managed to do it for as little as $3,000 or $4,000. But this means that agencies contributed a lot in terms of logistics, in terms of staff. So those are all still costs, but it did not require specific fundraising. And also, in terms of capacity building for staff, it often happens that when the training for CPRA happens and when staff are sent into the field, it helps them understand child protection issues in a new light and with much more depth, especially in areas where agencies struggle with finding and recruiting high capacity staff. Back to you, Rena.
All right, thanks. So a question about when the CPRA can be used. The list of countries suggests that the tool has been used for countries with major emergencies, but can the tool also be used for a country where there are no major emergencies like civil war, but instead smaller emergencies like hailstorm or a drought?
Sure. I mean, it's not. There's nothing to stop you guys from using it in different contexts. But I feel like in smaller emergencies, you have potentially easier ways of collecting data rather than a systematic approach like the CPRA. You can definitely use questionnaires that are developed within the CPRA. You can definitely use some of the guidance on data analysis and data collection in it. But I personally, if it's a really small emergency where funding is really scarce, I would say more traditional ways of going into communities and finding out from communities what the problems are in a more direct way um, might be more efficient. It doesn't mean that CPRA cannot be used. I just feel like it might be too much of a strain on your resources, unless you're doing it as an exercise so that teams in country are trained for potentially bigger emergencies. But again, there's no right or wrong answer to this question, I think. But yes, you can use it in any context basically if it fits the criteria set out in the guide.
All right. This is more of a comment from our Child Protection Working Group coordinator. Just a note that Uganda is doing a CPRA and has most likely not received training, so it may be a good example to compare with Somalia. Is that
okay
on your radar?
Good to know. I mean, when you say currently doing a CPRA, it means actually right now it's going on, or are they planning it for the near future? Because if it's the near future, I'm sure there are ways we can potentially connect with them to give a briefing over Skype or something to make sure that at least the common mistakes are avoided. But yeah, I mean, it will be a good potential comparison. And it also, I mean, we all use the Somalia context. We always struggle with access issues, with capacity issues. I mean, it's not an easy place to work, whereas Uganda would potentially be better in that sense than Somalia, if I can call it better, or less bad. But thanks for that information.
Of course. The last two questions that we have are logistical questions, sort of about accessing the toolkit and the reports. So if there are any other sort of content questions, feel free to submit them. But this looks like actually a good transition into talking more about the CPRA itself as a tool. Two questions. The first is, how can all of us access the toolkit? Second is, how can all of us access the reports from each of the assessments where the CPRA tools were used?
So the answer to both of them is the Child Protection Working Group website. I know that Child Protection Working Group website has been transitioning in the past few months. So there has been moments where the toolkit and the reports were taken down, but as far as I know, they were put back up. Don't quote me on that, but I'm pretty sure that they were put back up recently again. But the Child Protection Working Group website is the best place to go. It's cpwg.net, and then there's an assessment tab in it where you can go and find the toolkit itself, which is now translated into Arabic, of course English, French, and Spanish. And all of them are being printed out I know that the English version, the printouts are already ready. Arabic, French, and Spanish are also being printed out as we speak. So countries can receive copies if they request a child protection working group for a copy. They are also being put on thumb drives with memory sticks, so that the data management tool can also be attached to it, because the data management tool is an Excel tool file, so it can't be printed. I mean, it's not meaningful if you print it. But it's all there. One caveat, though, is that we try not to, after having seen multiple errors done in the field, one of the decisions that the Child Protection Working Group made at the time was that we try not to put the entire tool up, including the data management, as a way of making sure that people who need it actually contact us, so that we can, when I say us, it's a Child Protection Working Group, so that Child Protection Working Group can ensure that they know enough about the tool to avoid basic mistakes. So the Child Protection Working Group is happy to provide a quick briefing for those who want to use it, and following that you can also receive the data management toolkit. So it's basically not putting everything on the website is a way for Child Protection Working Group to ensure that people get in touch. And those who have not received any training will get some sort of a briefing to make sure they know enough. Back to you.
Right, it looks like there are no last questions, so perhaps we can switch gears now and talk a little bit about the CPRA and how to use it.
Great. Just switch screen. I don't know if you guys can see my screen now. Rena, is my screen shared now with everyone? This new presentation?
Yes.
Yes, perfect. Okay, thanks for everyone who joined again. If any of you have already been trained, don't want to stay on, we won't take it personally, but thank you for being there up to now. So this is basically a very quick overview of the toolkit itself, just in case people wanted to know more about it or refresh their memory on it. So we're going to touch upon a few things which will hopefully enable you to identify situations in which child protection rapid assessment should be conducted or could be conducted, understand the what we need to know cycle, which is a core part of the methodology, and know the overall structure of the toolkit, and also be familiar with the different methodologies used in the CPRA. So before we dive in, I wanted to quickly just make sure that we're clear on what the CPRA is and what it is not. It does provide us with a snapshot of urgent child protection needs. So I have had many occasions where I was doing either training or I was on the phone with people, and once I tried to explain what kind of things can come out of CPRA and what kind of things cannot, they got really disappointed. And I think part of the problem that we have in the field is a lot of the time people in the field don't have the time to necessarily investigate what are the best methodologies. They need something to use very, very quickly. Therefore, they don't necessarily look into whether or not CPRA is the best tool for that specific context where they are. And they use it and they get disappointed because it didn't fit their context. So it's important for us to know where this tool can help us and where it cannot. So it basically just gives us an snapshot of urgent action, urgent needs in terms of child protection. It gives us information for programming and advocacy purposes. The whole design of the child protection rapid assessment was not to to have a toolkit for an academic exercise or for long-term information management. It's designed to inform programming very specifically. Again, it's not a perfect tool for programming, but it gives you the good enough information. And it can be a stepping stone for more comprehensive needs assessment at the later stages, which will basically give you the basic picture, and then you can build on that in the future. If, for example, the issue of recruitment of children into armed forces and groups becomes an issue, then you can potentially do another follow-up assessment at a later stage specifically on that issue. So again, don't get disappointed if you go into the psychosocial part of it or the children associated part of it and see that every single issue that you're interested in is not covered there, because it was impossible for us to cover everything about every single component of child protection and still have a manageable tool. So what it is not is that it's not a comprehensive assessment or surveillance mechanism. It can be used as a stepping stone or the base for both of these things, but it is not a surveillance mechanism. It does not produce, because we don't use probabilistic samples, and we don't do simple random sampling, you can't use the information to generalize to the entire population, even though the sampling method that I'll speak to a little later is designed such that it will hopefully give you a pretty good picture of the general affected population. But it's not statistically generalizable to the entire population. And it's not meant to inform long-term programming. For long-term programming, you need more details than CPRA can give you. My suspicion is one of the reasons that we saw in the results of the review that several countries added other components to the tool was because they were using it 6 months down the line and they were hoping to use it for longer term programming, therefore they needed more depth in the results. Rina, I just want to invite people to maybe throw in their questions as I go on. I don't think we should necessarily wait until the end. So if anyone has a question, if that's okay with you, Rina.
Of course.
Yeah.
Yes, so everyone please do submit questions and they'll be answered throughout the presentation.
Great. Thanks, Rina. The next quick part that I wanted to talk about, I'm sure you all know about these principles. These are typical humanitarian principles, and some of them are specifically research ethics. But we try to adhere to all of these principles when we do the assessment and when we are designing it. The do no harm is very important for us. We do not want to go in, do something that will harm the community more than it helps them. The best interest of the child, confidentiality of information, of course, it's super important for us to make sure that the information that we get, it does not leak out in an identifiable manner. We need to recognize children and communities' capacities, the approach of needs assessment, and you'll see that more and more we're trying to stay away from the term needs assessment, even though you see it on the title here. But in the more up-to-date training package, for example, you don't see the term needs because it's not just about needs, it's also about the capacities of the communities and the ways they're responding to their own issues already. And then consideration of information already available means that if we have sources of information that we can tap into without collecting primary information, it's important to first look at those, make sure that we're not duplicating existing information. But sometimes if you look at the existing information, it will help you devise better questions and ask better questions to your respondents. So it's very important to do your desk review before you go on. And, oops, sorry. Non-hindrance of urgent action is in two senses. Is one, we don't want the process of assessment to put off other activities that need to happen today. A typical example that I give is that we don't want the entire child protection sector to stop responding to separation of children if there is a movement of population and we know that children are going to be separated. We can't say, oh, we are doing an assessment to see how separation is happening, therefore we can't yet respond. It's not ethical to postpone urgently needed action because we are doing an assessment. At the same time, while we are doing the assessment and data collection, if we face a case that requires immediate response, we have the responsibility to respond. And there are specific guidance in the tool on how to train your assessors on how to respond to urgent cases. And we have this most specifically because we normally do the CPRA, or the CPRA is designed mostly for places where services are not already established. And because of the type of sampling that we do, we will end up going to areas where no NGOs, potentially not even the government, is present. Therefore, we need to have a mechanism through which we can respond to individual urgent cases. It does not come up very often. In my experience, it has come up once or twice in the entire 2.5, 3 years that I've been helping with CPRAs in different countries. So it's not a common thing, but we have to be ready for it. And then commitment to action upon availability of results. We do not, again, as I said, we do not do this as an academic exercise. We have to do it if we are committed to do the fundraising afterwards and respond to the needs afterwards. I guess I was preaching to the crowd here, because I'm sure you all know this very well. Then the next issue I wanted to cover is this idea of what we need to know, which is the central piece of the design of the CPRA. We try to stay away from the term indicators, but if you are more comfortable with that, this is the equivalent of indicators, basically. It's basically a set of issues that you decide as a country or as a context that it's specifically relevant to your context and you want to learn more about. There's a list already provided in the CPRA guide of all the issues, and it matches the issues that are reflected in the child protection minimum standards. But in every single context, we encourage you to take those even before an emergency happens as a preparedness measure, adapt the what we need to knows, and the what we need to knows are going to inform your questions and questionnaires. So there is a cycle that we call the what we need to know cycle. So the what we need to knows that you decide upon in the beginning inform your data elements that you need to collect, and once you so for example, if your what we need to know is the patterns of separation of children, that's a very general statement, but for that you might need to collect 5 different data elements or data points to be able to inform that one what we need to know. So you might want to know what age range are being separated most, what gender is being separated more, is it specific ethnicity or religious group that are being separated more than others? Has it started from the beginning of the emergency, or is it something more recent? So a lot of questions you can ask to inform that one what we need to know that you have, which is the patterns of separation of children. Based on the data elements, you will be adapting the existing data tools. As I mentioned in the review presentation, be aware that significant adaptation of the tool will result in potential difficulties in the data management. But if you have the capacity to handle it, it's your choice. It's just a warning that I should give you. So what we encourage people to do in terms of adaptation is more about adapting your questions and adapting your answer options than adapting the whole structure of the tool. And then data collection and compilation is the next step, and then analysis and interpretation. And hopefully, if you have done the whole process correctly, the analysis and interpretation should give you the answers to what we need to know. So this whole idea is that if you do all the steps correctly, you will get the right results. Just quickly on when to do the assessment. As cautionary notes, we always say first develop a desk review. Always desk review is the first step. And then we also encourage people to, especially in earlier stages of an emergency, try to integrate child protection and other multi-sectorial assessments if possible. But best timing is, as we discussed in the previous presentation, is really dependent on the nature of the emergency. In rapid onset, that should be 2 weeks. At least 2 weeks should pass before data collection is initiated. Maybe I should explain a little bit one of the reasons that we say that we do not use the CPRA in the immediate aftermath of an emergency. First, we believe that the population normally faces life and death issues in the early stages, in the first days of an emergency, and issues such as food and shelter are normally much more pressing for the population. Therefore, once you start asking them questions about psychosocial status of children, they will not potentially give you the type of answers that you're hoping for, because it's not the most pressing issue in their mind. And for example, in Burkina Faso, one of the things that we did was we went for field testing in the refugee camps in the north, and we found out that there has been no food distribution for weeks. And people were very angry. They threatened several of our assessors. So we decided to contact WFP and find out when the next food distribution is planned for. They told us when it is, and we planned our assessment for right after it, because we knew that if we go back, we potentially put our assessors in danger, because people are angry, they're hungry, they see us as the same. They see no difference when they're angry between UNICEF and UNHCR and Save the Children and WFP. They see us all as those who are responsible for them not getting their food. So that's one of the reasons we try not to do the assessment in very early phases. But also, as you all know, a lot of child protection issues surface at later stages of an emergency. Issues of trafficking or increase in child marriage are things that you don't necessarily see in the first week after an emergency. The things that you normally see, which are immediate separations that happen after, for example, a typhoon, are things that we know happen. So we don't necessarily need to do an assessment for in the first week to start responding to spontaneous separations. Things that emerge later are normally the things that we are more uncertain about and we don't know how they emerge. For example, secondary separations is something that you want to find out about, but secondary separations normally don't start happening until a little while after the onset of the emergency. So these are some of the reasons we we try not to do an assessment in the very early phase of an emergency on child protection specifically. And I know that might be a little unsettling and not satisfying because people want information. But we encourage people to do your fundraising based on the things that you know happen in the first phases and leave the more comprehensive data collection for when it's appropriate, which is normally three weeks to 4 weeks after the emergency, starting then, and normally it would take you about a month to complete the process. And then in context where population movements happen, make sure that that population movement is concluded for the most part before you go in, because the changes in the environment is going to be too much, and people will not have settled into their new environment if you go in while they're coming in. So they won't be able to give you good answers about circumstances that exist in their care and living conditions. So now I'm going to go quickly into the different components of the toolkit itself. We have a short guide that provides more or less everything that you need to know about the CPRA itself. It's not very long. It's about 25 pages. Please read it if you're going to use the CPRA. We really tried hard to write it in a very friendly language. So hopefully it's not difficult to follow, even though at times it gets a little technical. Then it provides a group of sample tools that are sample questionnaires and checklists. And then the third component is the data management tool. Under the first component, we talk about coordination and planning, sampling, data collection teams, analysis and interpretation, report writing. There's small sections about each of those issues. And then the sample tools are also 5. We have a desk review template in there. We have a direct observation checklist that will help you, once you adapt it, that will help you read your direct observations. Key informant interview tool, which is basically a questionnaire that is the core of the toolkit, that again needs to be adapted, but it is the type of common issues that we have seen in many different contexts, and we have tried to capture all of them in the toolkit. Then a site report, which is basically a tool for you to compile all the information that you collect in each site. It's basically like a report of a specific site, because in one site you will end up talking to 3 or 5 key informants. You will do 1 or 2 direct observations, but we don't analyze those individual interviews or individual direct observations. We ask all the teams to compile the direct observations and key informant interviews into one site report for each site that they visit, and what we analyze are the site reports. And when I come to the data management, I will explain a little more. The urgent action form is a form I explained earlier that one of the components of the ethical approach to CPRA is to make sure that we have a procedure for urgent action. There's a sample form in the sample tools section that gives you a sense of how you can design a form for yourself. But urgent action process normally ends up being a standard operating procedure that sometimes already exists in countries for what to do when you face a case that requires immediate action. Sometimes it becomes just a list of names and phone numbers, but sometimes it's much more elaborate, and it talks about each region and who to contact about each specific issue. So if it's a child marriage issue in this region, you will contact person X. If it's a separated or unaccompanied child issue. But again, just have to emphasize that the CPRA is not about individual cases. We don't go around looking for individual cases that need support. This is only in case that, for example, you're doing an interview with a key informant and the key informant tells you that, oh, there is a marriage arranged for this 12-year-old girl that is going to happen tomorrow. Or there is this unaccompanied boy who is 9 years old and has been sleeping on the street for the past 2 weeks and no one knows who he is. Only in these kind of cases urgent action is required. It's not about if the key informant tells you, yeah, there are lots of children who are separated, but now live with their relatives. You're not going to respond to that. You're going to collect the data for that so that hopefully we design programs for it. So it's about individual cases that may come up we don't look for them, but we respond if they come up. Hope that's clear. Data management, it has 3 components: data entry, frequency analysis, and graphs. It's actually a very easy tool to use. It's very fast. You can enter up to 80 or 90 questionnaires or site reports per day. We have had, in the case of Somalia, for example, once we rectified some of the problems, we hired someone who was doing 120 questionnaires per day. So it's a pretty easy to use tool, and once you enter your questionnaires, it gives you all the basic analysis that you need, and it gives you all the graphs. But very basic frequency analysis. If you want to do more in-depth or fancier analysis using statistical methods, even though I don't necessarily recommend it, you can use other softwares and import your data from this tool to SAS or SPSS or whatever you want to use. But this tool gives you all the basic things that you need, and it allows you to disaggregate. You can disaggregate by gender, you can disaggregate by age, you can disaggregate by location. It's pretty easy to use. The only problem with it is that, as I said, if you want to adapt it too much, if there's significant changes to the toolkit that you're using, you will need to have someone who knows Excel pretty well to be able to do that, because the formulas can get a little complicated. But people have had very good experiences using it when it works for them, which is the majority of the cases so far. Just quickly to talk about some of the different methodologies. Desk review, as I mentioned, is one of the primary things that we do. More and more, the Child Protection Working Group is coming to terms with the idea that desk reviews are a very powerful tool, and we have to do them in every single emergency context in early days of the emergency. We even have started, at the time when I was with the Child Protection Working Group, we started a process of doing desk reviews for countries where we expected emergencies might emerge. So as a preparedness measure, we did desk reviews, for example, for South Sudan before the new wave of crisis started. For CAR, we did the same a while ago, and it helped the actors before when the new wave of violence started. But also when you're doing your assessment, doing a desk review will allow you to do a much better adaptation specific to your context. So desk review is super, super important. And there's information in the guide about how to do a desk review. And there's also, just so you know, there's a template that we developed within the Child Protection Working Group about a year ago that gives you a structure for the desk review. So you can actually access that on the website on cpwg.net, and you can download it and use it as your base for your desk review. Direct observation is the second methodology that we use within CPRA. It's, as you know, it's a very powerful tool or methodology. We underestimate it a lot, but observing yourself is very important in these contexts. A lot of the things that won't come up in a conversation with a key informant, including where children play, if there are potential physical hazards in the environment, things like that can easily be observed. A lot of the time you can observe the behavior of children if you have enough time to spend in the community, and potentially come up with some initial assumptions about whether children are playing or not, or whether they're fighting all the time, and things like that. Or if paths to schools are safe or not, you can actually go and observe it yourself.
Hani?
Okay, so
Oh.
go fast.
Hani,
Yes.
we have a quick question. How are you defining desk review? So that maybe going back.
Sorry. Yes. Desk review is defined as basically secondary data analysis. It's when you use existing information, including reports, news pieces, donor reports, evaluation reports, or previous assessment reports that exist in a context. Or sometimes it's basically the knowledge of those who have worked in the context for a long time, and you can do very short interviews of what are the things, what are the main issues that come up in emergency contexts. So you basically use existing information resources to compile a structured analysis of the CP situation in a context. Hope that helped. So the key from an interview is basically the core of the methodology. It's done. We encourage people to do it with adults mostly, but if you have the capacity, if you can ensure that do no harm is respected, best interest of the child is respected, and your assessors are well trained and know how to handle situations, you can also do it with children. We don't encourage you to use the key informant interview tool that we have with children because it's not an appropriate tool for them. You can develop a separate tool. But in general, in most contexts, we find that it's much safer, even though we know the quality is being compromised to a certain degree. We still think that it's worth limiting the direct contact with children when we cannot ensure their safety and we cannot ensure that our assessors are well trained on dealing with children. But one very important key issue about key informants is that they need to they need to speak to the experience of the community. Because as I will say in a minute, the unit of measurement for us is the community. It's not an individual. So we don't want someone who can talk about his or her family. We want someone who can talk about the community. So a teacher, a community leader, a social worker, an activist in a community are people that we want to talk about, and not someone who's a mother and only tends to her own children. So that's a very important piece that we need to keep in mind. And urgent action I've already explained. I'm going to pass. Site report I also explained. It's important to say that first, site reports can be skipped. We believe that it will reduce the quality, but it's a very good opportunity for the team members to sit together at the end of each day, once they're done with one site, to consolidate all the information that they received into one site report, and they will discuss the issues, and they will basically come up with common statements about different issues that were raised in each site. Analysis interpretation. I'm sure you all are familiar with the difference between analysis and interpretation. Analysis is very mechanical. It's about creating summaries of the existing data. interpretation is the process of making sense of all the information that you received. So if people say 20% of children are separated, what does that mean programmatically for you? That's the interpretation process, and that's when we suggest is the only safe place, or again, in general, is the only safe place for you to involve children in the process of informing your programs in an early phase of an emergency. So it's a very good opportunity for you to potentially involve children in interpretation. Just quickly, the last point I want to make is about technical considerations of sampling. Unit of measurement, as I said, is community, is not an individual. So you will see that all the questions in the CPRA are addressing the community. They're all asking about the group. They're not asking about individuals. So we're not going to come up with exact number of children separated in the community. We're going to come up with a range of existing separated children in the community, for example. So it's a community level data. The sampling that we suggest is a propulsive sampling, which has a very specific process. There is a tool that can be shared with you to help you do the sampling. What we do for the sampling is basically come up with different scenarios that define how different groups of population are affected. For example, if you're in an environment where there are IDPs, there are host communities, and there are people in camp. You might want to separate these three communities if you can, if they're physically separated, because you know a group of IDPs will have, who are living outside of official camps, might have very different needs from the host community who's receiving them, who might have very different set of needs and capacities as compared to those who live in official camps where services are available. And once we separate, we don't have time for me to go into much detail of this. It's actually a fascinating process. Those who have done it know what I'm talking about. Yes, I can send the PowerPoint presentation to participants if you wanted. So the tool that we have developed basically helps you to, first you have to identify those scenarios that exist in your context. What are the things that make different parts of the population different in terms of their needs? And then you plug it into the tool and you start going down the list of every single unit of administrative unit, for example, a village or a neighborhood in a city. And based on that, you come up with a minimum of 15 sites for each of your scenarios. That's the recommended number that we have come up with out of the existing literature on qualitative work. It's not a precise number. It's not based on a fancy calculation. It's based on experts' opinion. We consulted multiple experts in qualitative research, and this is the number we came up with. This existed in the guide. And just one point about unit of measurement or site. The meaning of a site or your unit of measurement might be different in different contexts. So in a rural environment, you might define a village to be your site. In an urban environment, you might define a neighborhood to be your site. And in a camp context, for example, you might define a block of a camp to be your site. So in one assessment, you might have three different definitions of a site, but they should correspond to each other more or less in terms of the size that they have and the way you can reach them. And once you have defined your scenarios, excuse me, within each scenario, we will do a random selection of those sites that fit within the scenario. And just to emphasize on the fact that scenarios are not just geographic. It's not about just saying, oh, these people are in rural areas and these people are in urban areas. Anything that can make you think that this part of the population will have a different set of needs and capacities, then the other one should basically lead you to separate them into two different scenarios. It might sometimes correspond with geography, sometimes it doesn't. So it's important to have that in mind. Some of the common methodological mistakes that we have seen in the field: sometimes people don't use any sampling methodology. It reduces the quality of your results because you can't speak on behalf of a larger population, even though we know that it's not statistical significance or representation. But if you follow the sampling strategy, you will get a much better idea of the reality within the population. Sometimes unit of measurement is not defined. People go into households, which is not our unit of measurement. And the tools that we have developed, as I mentioned, are for key informant interviews with adults. If you want to do focus group discussions or interview children, make sure that you design a separate set of tools that are more appropriate for children or for focus group discussions. And sometimes collecting too much information, it becomes a problem because you don't have the capacity to analyze it. So think about data analysis before you decide on your data collection. I know time is up. I give it back to Rena. I don't know if you have any questions from the audience or you want to close it. Thanks, everyone.
Yeah. Thank you, Hani, for sharing your expertise both on the CPRA and the review of the CPRA that you conducted. I think it was very useful for all of us who were able to make it today. And thanks to all of you also for participating today and asking really great questions. We hope that the webinar was useful for you. A recording of the webinar and the PowerPoint slides will be made available, as Hani mentioned, and we'll send those out in the next few days. We look forward to your participation on future webinars with the Child Protection and Crisis Learning Network, and have a great day. Thank you.
Thanks, everyone. Bye.